And we are now live. So, good evening, everyone. Manish, is it good to go ahead?
Absolutely, please.
Perfect. So, whilst we wait for everyone else also to come in the sense the waiting room is switched off, they can start coming in, but we can start on time so that we are over also well in time. Um, the concept or the inception for this session came about with our alumni friends volunteering to share the information that they have on a day-to-day basis, them being Dr. Nidhi and Gautam being with the Delhi government. So there's a lot of information that they see which is floating around on WhatsApp groups and messages, which is misinformation. Our esteemed panelist, Dr. Nidhi Dhawan, who is from the batch of 1987, is an MBBS MS ENT with the President's Gold Medal from Delhi University. She is a part of the COVID task force, and she's the COVID task force secretary, IMA NDB. She's an active member and convener with Dr. KK Agarwal for a regular Sunday morning session, which they happen to take place, where the doctors for the COVID preparedness are sharing information. So we also have Gautam, who will be asking the questions. So what we had done is we had created a registration link, invited people to ask questions that they are not usually able to get correct answers for. So Gautam is going to help us moderate the session. Gautam is from our 2011 batch, and Gautam is working with the Delhi government since 2005 as a policy consultant and an advisor to the Delhi Commission for Women. I now hand over the stage to Gautam to ask the questions and maybe share your feedback. And thank you, Dr. Nidhi. Thank you, Gautam, for taking it ahead for us.
Thank you so much, Suman. Thank you to the Bhavnites Association for this wonderful opportunity for all of us to come together and clear our serious doubts which we have about the situation, because the situation is such that there is lot more of misinformation, lies and falsehoods spreading around than actual real facts and information can actually benefit people. It's very important in this age when we are always on WhatsApp and it's easy to spread anything like wildfire, for us to be aware in the right sense of the true and real facts of an epidemic of this proportion. Lives are being lost every minute, and the situation is going from bad worse to the worst in every city we know of in India and everywhere else. So thank you, Dr. Nidhi, for this concept, for coming forward to interact with your fellow alumni and to clear for volunteering to clear our doubts. We have a brilliant set of questions which was asked by our alumni who had registered for this event, and I will now begin to start. Before that, I would just like you to say two words to welcome everyone, and how this session is going to be, just a little idea of that if you can give. Thank you.
Very difficult to say it in two words, but two words can be just thank you. I think Bhavanites Association has at least provided this platform whereby we can begin to address the issue, especially in the city, but maybe in the country. We are all far-flung and distributed over the country and the globe. It would be good if we follow the dictum, knowledge is power, and empower our Bhavanites to tackle the situation at hand with a little more knowledge and a little more confidence. I think that's my main aim, to work from knowledge.
Absolutely, ma'am, and knowledge and correct facts and the way to go about it is absolutely critical at this juncture. So, ma'am, the first question I want to ask from you is a general question, which is that now we've had COVID in our lives for more than a year, and a lot of people still don't realize that COVID in 2019-20, which originated from Wuhan, and now COVID in 2021, especially these last few weeks of 2021, those two variants are very different. We have new mutations. We have very, rapidly evolving virus, which now some people are calling double mutations and even triple mutation. So I want to ask from you, how was COVID-19? And if I may say, how is COVID-21? What are the differences? How have the symptoms evolved? And what needs to be done for us to get that awareness level to that higher point?
So to put this quite briefly, COVID-19 is the disease caused by SARS-CoV-2. The SARS-CoV-2 is a coronavirus which evidently originated in Wuhan in 2019 and escaped to involve the whole globe. But there are now emerging evidences that there were at least 4 copper mine workers who in 2012 contracted a similar disease in China and died of the disease in 2012. The blood samples from these infected people were under investigation, and in the usual course, there are hundreds of circulating coronaviruses which cause usually mild upper respiratory infections, hamara khansi zukham. The viruses in the past, the MERS that was in 2003, I think, and the bird flu that came in a little earlier, have evolved from those coronaviruses and caused more infection, severe infection, and infection which went beyond the upper respiratory tract, and khansi zukham se zyada it landed in the lungs. The SARS-CoV-2, the present virus, not only restricts itself to the lung, but spreads like wildfire through the body, and is not just the effects of the viral infection that we're dealing with. We are dealing with a multitude of effects in the body. So we are dealing with a viral infection. Then we are dealing with the inflammation that this incites. Then we are dealing with the body's response to this inflammation through certain pathways which causes thrombosis. So clotting and swelling, and so it spreads like wildfire, destroying all the systems that would otherwise save the body. The difference between the virus that was in 2019 and what we are now seeing in India, we call it the double mutant because there are 2 significant mutations, and these are happening on the spike protein domain. So the virus is composed of the body, which is the envelope. It's composed of the nucleus, which carries its nuclear material, the genetic code, and it has got those red spikes that are so characteristic in all the pictures that you see of the coronavirus. These spikes are what allow it to attach to the human cells. The vaccines at present are targeted against the spikes. And unfortunately, the Indian variant is showing 2 significant mutations on the spike domain. So these are the EEC and the LAR mutations. They are the E484 and the L452 mutations. What is happening with these are not new. Individually, they have been seen in the US and the UK, but together they are new. Together, they are present in the Indian variant, and despite a little sluggish response from from us in terms of labeling it as a variant of concern. The world over, we are labeling it as a variant of concern because it is making it at least 20 to 30% more transmissible and at least 50% more resistant to antibodies.
Dr. Nidhi, we have lots of questions, so you'll have to be a little briefer.
Yeah.
Thank you, doctor. So another question regarding the symptoms is that earlier the virus was not known to be airborne. Now it's increasingly being accepted that it is airborne. Maybe the 6-meter social distancing might not work. What is the kind of mask that we use? Which mask would prevent these now finer particles of this virus from spreading? And another question which is very much there is, earlier it was known to spread from surfaces. Is it now the same, or is it now only limited to direct interaction? So what kind of evolvement has happened from what we had learned last year? And now how to deal with those symptoms? What are the new symptoms as well on this?
To give you a perspective, nothing has changed in terms of what you were following earlier. What you were following earlier still holds. Social distancing still holds, masking still holds, hand hygiene still holds. So the fact that it has now become largely airborne does not mean that it is not droplet, does not mean that it is not going to be transmitted from surfaces. The fact that it has become airborne means that the particles are now even finer, so a single mask might not be enough. It means that gamcha, chunni, burqa is not enough. It means that if you're wearing a homemade mask, it should be at least 3 layers or 5 layers, preferably. If you're wearing an N95 mask, it is good to wear a cloth mask on top of it so that you can discard or wash that cloth mask. If you're wearing a surgical mask, it is good to wear 2 masks and discard the top mask. Discarding these masks also should be so that they do not add to circulating virus. So if you're using pre-made surgical masks or N95 masks, cut them. If you're using cloth masks, soak them in detergent and soak them in Dettol. For half an hour, it is enough. The symptoms stay largely the same. There is, on the lighter note, I know that we should not be joking about it, but coronavirus causes everything except pregnancy and fracture. Any symptom in the body that more than one member in a family have potentially is corona.
That is actually the most serious part.
Yeah.
So what you mean to say is that if you are having only headache, only loose motions, so only headache is not your simple migraine, only loose motions is not your simple diarrhea.
Absolutely. Absolutely.
So you have to get your alertness levels
high.
To the very high, and keep on the watch that if it more than you, if your family members, friends who you met recently, or the people you interacted with are having similar symptoms, it is most likely to be COVID, and you have to treat it as such.
And also be socially responsible. If you don't have to go out, please don't go out.
So, ma'am, the question that flows from this is, a lot of people are saying that my RT-PCR came negative, my rapid antigen came negative, I'm still showing symptoms, my family is also showing symptoms. There might be some variation, some are showing severe symptoms or mild symptoms. But again, RT-PCR is not catching it, rapid antigen is not catching it. How should I deal with it? Should I take it seriously, or is it just some other seasonal flu?
So most of these tests are based on the spike protein. As I said, the Indian variant is now showing variation in the spike protein. It is beating the RT-PCR. It is beating the rapid antigen test, which in any case have a high degree of false negatives. I mean, in the rapid antigen, it's only a 30 to 50% positivity. So if you have a rapid antigen positive, for sure you have COVID. If it is negative, you still could be having COVID. In RT-PCR, initial strains were showing up to 70% positivity. That means it was still 30% non-pickup rates, false negatives. But now that rate is climbing. So if you have symptoms, if there is more than one family member or close social contact who's showing similar symptoms or even symptoms which are unrelated, somebody could be having headache, somebody else could be having stomach pain, somebody could be having cough, cold, or just a simple foreign body sensation in the throat. Everything could be COVID. The sooner you pick it up, the sooner you start supplementing, taking warm fluids, taking steam, the better the outcomes.
Absolutely. And another important point that comes from your comment is that don't think that COVID will react in the same manner for everyone. Everyone will be having different symptoms. We have seen this last year. People infected at the same time from the same source will be showing two completely different set of symptoms.
Absolutely.
So please be aware of that and don't think that only I am having loose motions and my one parent is having headache, one is having stomachache, all three of us are having different problems. So I think we have made that clear. Ma'am, another question frequently asked, people are confused about is when to isolate, how to isolate, and then when to de-isolate, like when to come out of that isolation, especially in the scenario that we have discussed, we are having false negatives.
So when to isolate, if you get to know somebody you interacted with more than 15 minutes, has developed any symptom that could be COVID, you isolate. Because there is a lot of asymptomatic, pre-symptomatic spread. So for the first 3 to 5 days, you may not have any symptoms, but you will be shedding the virus. So the time to isolate is when you realize somebody you interacted with has symptoms. If you develop symptoms, your isolation continues for at least 10 to 14 days from the first symptom. And these guidelines are rapidly evolving. We used to earlier say that 10 days was enough, that the virus becomes non-transmissible or non-viable after 10 days. But we have raised that to 14 days now. So you do your isolation for at least 14 days from your first symptom or 5 days from your last symptom without medication.
Absolutely, that is very important. And I think it is very critical for us to realize that we don't have to wait for the symptoms to develop for us to realize that we have got COVID. As soon as you get to know about it, any of your contacts has it, please start to monitor, please start to socially distance within your houses. And this precaution might be difficult for you to do. It might cause some discomfort, but in the long run, it will definitely help you and your loved ones a great deal. So,
and Gautam, the very important thing about Indian households is they're all multi-generational households. So you have people of varying vulnerabilities in the same household. So it becomes extremely important for people who are mobile, who are the breadwinners and the bread earners in the 20 to 45, 55, 65 bracket to understand that they could be giving it to people less than 18 who are not yet eligible for the vaccine, or more than 65 who will respond very badly to an infection. So these people have to be extremely careful. And even though it is asking for too much, please wear a mask, even at home, if you think you have been exposed.
Right. Absolutely, ma'am. Last question on the precautions is that people are wearing masks. So most likely you will prevent the virus particles from entering through your mouth. At the same time, we are not using face shields is not that common. It's something we associate generally with doctors and healthcare workers. washing your hands, these kind of things. I think there's a lot of COVID fatigue that has happened in the last 1 year. So I want to ask from you how critical it remains for us to protect our eyes, our hands, and what else, how else can we get this virus except from the, other than the mouth?
So the virus generally comes from the nose, not really from the mouth. So cooked food will not give you the virus.
Okay.
A normal, ordinary person touches his nose and eyes from 16 to 25 times an hour. 16 to 25 times an hour. So if you're wearing glasses, you will probably touch your eyes like this. So those protective goggles prevent your hand from going into your eyes. Why this is important is because you will touch surfaces which have been contaminated. It is still transmitted by contaminated surfaces. It is still viable. The only way to protect yourself is to be extremely careful of your hand hygiene. Wash your hands or sanitize your hands at least every 2 hours or whenever you remember to do so. It looks excessive. Believe me, it is not. Please be conscious of how your hands are moving to your nose and eyes. This is the easiest way for the virus to get into your body. Mouth is only because mouth is open to the exterior. And even when people are wearing the masks wrongly, the mouth is largely covered. The mask needs to be a good fit. It needs to cover the nose. It needs to hug the chin. It needs to be tight from the side. When you blow into the mask, it should inflate a little.
Next question is on the testing, ma'am. And it is that now that we are seeing that there are huge queues for testing as well, how and when should we get tested? Which should be the test of our preference for what kind of symptoms? When can we go for the rapid antigen test, and when should we go for RT-PCR? And then now the new test of HRCT scan. When is that a must, or when should we go for a CT scan? If you can clear the air about these different tests and how and when should we go?
The one thing that this virus has done is taken us back to basics, whether it is for the patient or for the doctor. So for the patients, basic hand hygiene, covering yourself, being clean, all those precautions are ordinary things that you teach your nursery and KG kids. Wash your hands, stay safe, don't touch your nose. These are the basics. For the doctors, if a doctor suspects clinically that you have COVID, you have COVID, irrespective of what the tests show. The tests right now are in short supply. I don't know, you might be able to throw more light on it. I received a message today that for the next 2 days, the kits are so short that home collection has been stopped. So we as doctors are moving to really basic tests. Those basic tests are your complete blood count, which allows us to gauge what is the severity of infection, if there is any infection, and the CRP, which tells us what is the level of inflammation in the body. We can initiate treatment on these 2 tests. These 2 tests then can be done on alternate days for seeing the trend 3 times. That means on day 1, day 3, and day 5 at least. If the trend is rising, then you do it on day 7 and 9 also. If the trend is falling, you are comfortable and the patient will show clinical signs of improvement. In case, and this is for the doctors, in case the blood work shows alarming signs, a CT scan may be ordered. CT scans may also be ordered for people who are showing signs of breathing difficulty, of unrelenting cough, of fever more than 101, 102, of feeling of ghabrahat. All these are indicators that you should be getting a CT scan. However, a CT scan is something a doctor would need to order. We should not be panicking and rushing to CT scan centers. We should not be panicking and rushing for RT-PCRs and CB-NATs and RATs. Kits are precious. We should be doing simple tests which allow us to cover more population.
Right.
Nidhi,
again,
I'm just, Gautam, give me a sec. So there was a question from Prithvi, which I think you have answered, that which are the various tests required for this new mutant. And what you are saying is we are going back to basics. So even if we do not have the RT-PCR kits, you can get two tests. That is the complete blood count, CBC, and you said CRP test, which is regarding the inflammation.
Right.
I'm also hoping, today, at least in Delhi, it's very difficult to get any test down, but hopefully we will settle down in another 4-5 days or a week when possibly things will get settled down. There are another two tests which doctors are recommending. One is D-dimer and the other is IL-6. So can you just elaborate on that?
The D-dimer is a further metabolic product from CRP. So, and IL-6 causes the CRP to rise. So these are sequential in the disease pathogenesis. In case we are doing CRP, we are also monitoring your D-dimer as well as your IL-6 without really doing those tests. CRP costs something like 250 rupees. A D-dimer costs something like 2,500 rupees. Yes, it would be indicated in some situations. Yes, a doctor would need to order it sometimes. But the very basic CBC and CRP will largely equip a doctor to initiate treatment and monitor it.
Absolutely. Thank you so much.
Thank you.
I would like to reiterate here at this point is that we should have our emphasis on testing, but it should not be our criteria to start treating our symptoms or situation as COVID. If, as ma'am has made it clear, we have said it again and again, if you are showing symptoms or you come in contact, treat it as such. Don't wait for the test to come, because every testing apparatus as well is heavily under huge workload. So hopefully you'll get the test done, and most of us won't be able to have the luxury of having medical advice or assistance from the initial stage. In that situation, it's very important for you to self-isolate and self-treat it as COVID. Take it seriously. Ma'am, the last question here is for self-treatment. What can be the basic things that we can do on our own? Obviously, we have to take expert help, help of a physician, help of an expert doctor. But what can be these things? Like we have come across multivitamins in COVID, all these things. So what can be these basic things that we can start from the first day?
So the first thing that we can all do is go out into the sun on our own terraces and balconies for about 20 minutes to 30 minutes every day. Given the fact that we live in India, which is largely a tropical equatorial country, our vitamin D levels are abysmally low. And you don't make vitamin D with sunlight coming through a window. You don't say that, you are sitting in the car with the window rolled up. You don't get vitamin D like that. Vitamin D, as Manish had pointed out, IL-6, vitamin D acts on the IL-6 pathway. If you feel that you cannot access medical help and you are at risk of having contracted COVID, please take vitamin D 60,000 units day 1, day 2, day 3, and then you can use this on a weekly basis as long as you remember. Take vitamin C 500 mg every day, morning, evening. You could also increase the use of fruits like lemon, oranges. All these citrus fruits have enough vitamin C. Also, the vitamin B and zinc are usually in combination. Zinc also works on the IL-6 and D-dimer pathways. It also inhibits the growth of the virus in the extracellular fluid, in the fluid that surrounds our cells. So it doesn't let the virus enter our cells. So zinc and vitamin B, vitamin C morning and evening, and vitamin D at least once a week, but go out into the sun. These are the very basic minimum that everybody should be doing. The other thing that I want to emphasize, this virus, we have noticed that things which are bitter and things which are astringent are causing suppression of viral loads. So onions are great. Kalmeg is great. And these are all things which are available in your kitchen. If it is bitter, if it is astringent, use it liberally. Local produce in raw form. Don't use cooked onions. Use it in salad. Use a teaspoon of Kalmeg in your tea morning and evening. Use turmeric. Anything which is astringent, anything which is bitter. If there's one message I can give you, jitni bitter cheezein hain, Kalmeg is the bitterest thing I have ever tasted. And it is available on Amazon. Probably after this will also sell out. And we should not hoard. Please share. Please share with your families, friends. Don't hoard. Nothing. Please don't hoard.
Yes, I was going to get, yes, sir. Yes, sir, please go ahead.
Manish, I think you're...
Yeah, I think there's some problem. In the meanwhile, I'll continue with the question. Ma'am, there are a lot of questions about the vaccines.
Yeah.
So we won't go into which is better, which is, more preferable.
No, I totally could, but I won't go there.
Yes,
okay, so
let's not go there. But
the choice is not which vaccine.
Right.
The choice is vaccine or COVID.
Right.
Both vaccines are safe. As of today, the data says both vaccines are effective. So to give you the perspective, UK strain has at least one mutation on the spike protein which we share.
Right.
And UK has seen a dramatic fall in the number of cases that they are reporting now. We have vaccinated, to my last figures, we have vaccinated 127 million people. Say for the sake of calculation, let's say 130 million. But our population is 1,300 million. So we have vaccinated only 10% of our population. US has vaccinated 130 million. We started after them. We have caught up with them in the vaccination. But our numbers are too huge. They have vaccinated 25% of their population and they're already looking at herd immunity. Their numbers
what
are
you
now...
mean to say is the importance of getting the vaccine. If you can get it,
absolutely.
If you're eligible, there's no doubt and question about it. Is there a category or a comorbid situation for some people who should be careful before getting the vaccine? All sorts of this is now when we come to the WhatsApp University, you are getting messages like this vaccine will have adverse effects. Some people are getting chicken pox. All kind of fake messages are circulating.
So what I can say is that both these vaccines are extremely safe. As of today, the data says extremely effective. I am biased towards one vaccine, but I have received the other because I had no choice.
Right.
And I'm biased towards the Indian vaccine.
Will not.
So I'll tell you why, and I'll tell you there is logic to it. The logic is that the Indian vaccine has all three components of the virus. Even if one is mutating, the others will take over. And eventually, you being in the government, we will have to see that we give at least the frontline workers one dose of the Indian vaccine so that their immunity is boosted, because you will land up in shit if you don't have frontline workers to deal with what is happening.
Absolutely.
However, given that, see, the only contraindication, the only absolute contraindication to vaccination is that you are allergic to a component of the vaccine, which is very rare. And even that you can have under supervision with a steroid and an adrenaline injection, the vaccine can be given. Pregnancy is not a contraindication. Allergies like cold, cough are not a contraindication. Asthma is not a contraindication. There are people who are being extra careful. They are being fearful. It's perfectly safe to go ahead and be vaccinated.
Right.
Definitely safer than getting COVID.
Okay. So there are a couple of scenarios people have raised, ma'am, for the vaccine. I'll just list those scenarios, and if you can answer them. First, between first dose and second dose, earlier both vaccines were 4 weeks. Now the Serum Institute's Covishield is 6 to 8 weeks, and Covaxin is 4 weeks, 4 to 6 weeks. So what is the ideal period for both? That is one. Secondly, the situation people have asked is, what if I was COVID positive and recently recovered? When should I get the vaccine? After waiting for how many days? What if I get COVID after the first dose? Then does the schedule for the second dose change? Does my recovery period count in the delay in getting that vaccine? And thirdly, after getting the second dose, when will I have full immunity? Whether will I have full immunity? Can I get rid of those masks and face shields? And or till how long should I wait?
So the first part of it was I had COVID and I need a vaccine. That was it. So how soon after COVID can I get a vaccine?
Yes.
So if you had COVID, your body has memory. The first dose of the vaccine is supposed to give you memory. So the vaccine becomes actually your second dose.
Okay.
The body's immune response is documentable in 2 to 3 weeks after the initiation. So after recovery, the same as in your serum antibodies becoming positive, around 3 weeks, you would know whether you have become antibody positive.
Okay.
The problem with natural infection is that these antibodies may not last long enough. So you do need the vaccine.
Right. So even if you are recently recovered, that will not substitute for the first or second dose. You have to get both doses.
You have to get both doses. However, you have to wait 3 weeks.
After recovery.
After recovery.
Understood.
You got the vaccine and then you got COVID.
Yes, after the first dose.
So your vaccine was your initiator. You got COVID. It has become your second dose.
All right.
However, this second dose, we know, would work as a second dose only in that 4 to 6 week window. So if you got it within 14 days of your infection, of your injection.
First dose.
Yeah. So it's still like you got COVID and then you got vaccinated. So you still need 2 doses.
The second dose will not be substituted.
No, will not be substituted. You would still go for the second dose. Between any natural infection and vaccination, keep 3 weeks. If you can afford it, try to get an antibody titer done before you go for your dosing.
Absolutely. In case you are recently recovered.
In case you are recently recovered.
The infection after the first dose, antibody test is recommended. And again, you can consult your physician. Moving on, ma'am, the last part was, when do I get full immunity?
So, to all present data, this vaccine provides immunity to 80 to 90% of people. If we trust them, and we should, 10 to 20% of people will not get immunity. We don't know which 10 to 20%. So till we have absolute numbers in the country coming down, you cannot get rid of your masks hand hygiene, and face shields.
Right.
You can get yourself tested for antibodies to decide whether you got immunity 3 weeks to 4 weeks after your second dose.
Okay.
If you did, you are immune, but basic politeness and social etiquette would still dictate that you continue to mask, continue to follow hand hygiene and social distancing till absolute numbers are down.
Right.
With the variants coming in, there is absolutely zero tolerance for wrong masking or non-masking. Zero tolerance.
Okay, so can we now have a quick question and answer session?
Sir, there are a couple of technical questions which I wanted to ask.
Okay.
So I'll just get them over with as soon as possible, and then we can open the house for everyone. So, ma'am, there are a few technical questions people have asked. One is about CT value, which you get to know with your COVID test. What are the ranges of CT value, and when do we treat ourselves as positive or negative depending on the CT value?
I will say this very, very briefly. A CT value is a cycle threshold, which means that how many cycles you need to do to get a positivity, negativity result. If your CT value is close to 30, you are considered negative. If your CT value is in 20s, you have moderate viral load. If your CT value is less than 20, you have high viral load.
Right. And
this does not dictate disease severity, only load of the virus you're carrying.
Absolutely. So now a lot of requests are going around for plasma, remdesivir injection, FabiFlu. Whenever you open your social media, you will find hundreds of requests that we need plasma.
So remdesivir and FabiFlu.
The people are demanding these things without actually needing them, because it's become a trend that plasma will definitely cure you in no matter which serious condition you are in. So please clarify on that.
So remdesivir and FabiFlu are antiviral agents which act on the virus when it is multiplying, which is in the first 7 days.
Right.
If you are already in the 8th day of infection, even if you are having a very bad case of COVID, there are other treatment options that you should be using. Okay. If we overuse remdesivir and FabiFlu in patients who are beyond that 7-day window, we are only satisfying ourselves कि हम कुछ कर रहे हैं. They are not mandated at that time. They are only heroic effort on our part. There are other things to do at that time. As for your plasma. So plasma, if we are looking at neutralizing antibodies, and if the plasma that has been donated is for the neutralizing antibodies, it will work. But it comes with a caveat. The reason why we are having these double mutant strains is because we have used plasma also in situations where we could have avoided it. The only way to prevent mutation is to prevent transmission and persistence of the virus.
So now I think it cannot be said, more emphatically that please don't self-diagnose. If you feel you need these things, please, in that case, get medical help, and we'll be sharing some resources for you to get this medical help on the WhatsApp group. Hopefully you can find it there. And now in age of WhatsApp, one positive thing is that you can reach out to everyone and get these resources together. So don't self-diagnose, get expert help before taking these external injections and plasma and everything else. Ma'am, another question is oxygen saturation levels. Now what we get very often is the mutations are affecting even the youth, which was not seen at a large scale last year. young children, minor children, infants are getting COVID. Senior citizens are, very affected to a large extent, more seriously affected than last year. Now, SpO2, it's generally said that your saturation, if it becomes, last year it was below 90, now most people are saying below 95, you should get alerted. But at the same time, people are saying senior citizens tend to have lower oxygen saturation levels, even otherwise in normal conditions. What are these different ranges for different age groups? When should we get alerted? When is it a total emergency? When is it, time to get your act together? Like, what are the levels of us to get alert?
So everybody may not have access to oxygen saturation, but everybody has access to their own pulse rate. If walking for a minute or two makes you breathless and your pulse go up more than 20 to 30 from your baseline, be alert. If walking 6 minutes causes your heart rate to go more than 100, be alert. Oxygen, people can monitor on their smartwatches also. Most smartwatches are now giving us the option to monitor oxygen. If you are monitoring oxygen, be sure of what your baseline levels are. A drop of more than 4 from the baseline, you should be alert. So a person who is already on a baseline of 94 needs to become alert at 90. A person who is a baseline of 98, 99 needs to become alert at 94, 95. To give you an example, my father is 81 years old. He is regularly working out, even lifting weights, and he's physically quite active. So his baseline is 99. I would be alarmed if it was giving a reading of 92, 93. But my mother is more sedentary. Her baseline is already close to 90. I would not be alarmed if it fell to even 88. So you should be more aware of your own body, and pulse is easier to monitor than oxygen. A drop of more than 4 units is significant.
So baselines, ma'am, just to clarify for everyone, baselines are those readings which you get in normal conditions. So it's recommended for you, because the pandemic is out there, that have these small sessions with your families where you come together before, on the dining table before eating dinner. Just have your measurements for pulse and oxygen. You'll get to know in 2 or 3 consecutive readings what is your baseline. Am I right, ma'am?
Absolutely.
Thank you, ma'am. And now I'll open the floor to questions. People have been asking on the chat box, and we have taken up those questions. I think if there's anything left, please go ahead and ask.
I think, Gautam, this question is significant. If we have taken the first dose of Covishield, can we have Covaxin? As of now, no. Vaccines cannot be mixed. As of now, there is no, they cannot be mixed. If you had Covaxin, you cannot have Covishield. If you had Covishield, you cannot have Covaxin. However, there are studies going on in UK which say that they would like to replace the second dose of Covishield with Sputnik. That's because the two work on a similar principle but carry a different viral vector. That's a technical detail. But as of now, we cannot mix the two vaccines.
Okay, so my request in the question answers session would be not to ask very specific questions which are pertaining to you or your family. They can be addressed, directly. We will connect you to Dr. Nidhi, and we have other people also whom we can connect you to. But if you feel that your question is a question which is addressable to a large number of population, please go ahead and ask that question.
Manish, and this is also a significant question. Veena Mani has said that I'm a journalist. I have already become COVID positive once. Can I get it again? Yes, you can. The present mutations are notorious for reinfection. You can.
Antibodies, you cannot be sure. I think, ma'am, you'll agree that for how long the antibodies will exist, this will vary from individual to individual. and don't trust your antibodies so much that you've recovered and now you won't get it. Even when you are vaccinated, don't trust it. You have to keep up with the precautions.
See, even if the antibodies are formed, most of these vaccines are based on spike protein. And spike protein is the one that is mutating. So don't assume that you're protected.
I see Mr. J.K. Dhar has said that he has a question. He would like to be unmuted.
Yeah, I'm trying to unmute
Sujata
him.
Chaudhary. Okay.
I'm trying to unmute JK Dhar Saab. Suman, can you help?
Yes, just a moment.
Sujata Chaudhary ma'am has also asked.
So first let's have the question from JK Dhar Saab, and then Sujata's question was answered or not answered?
She has raised her hand again. I think
People can write down their queries in the chat box. Suman, आप भी देख लें, मैं भी देख रहा हूँ. We can try and address maximum questions.
Yeah.
Dhar Saab, you are unmuted. You can speak now.
Thank you very much. Well, I had this, Dr. Saab, you said surface transmission is still up there. But I was reading a CDC report 3-4 days back, and it had come in the newspaper too. And that said that they kind of were very strong on that surface transmission. It's not through surface transmission. Any comments you could give on that?
If it is airborne and if it is droplet borne, it is fomite borne too. And I would say that in this case, I would beg to differ with the CDC. Anything that causes virus to be seeded on any surface like door handles, even transmitted from hands, is still a hotspot. And why US is not so concerned about surfaces is because they have nearly a 25 to 30% vaccination rate and nearly a 25 to 30% infection rate, no mutants, so they are at herd immunity. They are taking flights, they are going on beaches, and their cases are not rising. They are having youth sports events. CDC is talking in the US context, not in the context of the Indian virus.
So that's the bottom line, that we don't necessarily look at US, UK, Italy, anything. We got to look at India and what we are being advised, right?
Absolutely.
Sujata ma'am has asked her question.
Gautam, we had Mr. Ramakrishnan with us. I think he's just left the Zoom session. Mr. Ramakrishnan is possibly one of the senior most Bhavanites who are connected to us, possibly from the 1962 batch. I was about to kind of invite him to ask a question, but then I think he has just left. But it just shows that our connections go, Bhavanites connections go deep all the way down to 1962 batch.
Absolutely.
Dhar Saab is 1964 or 65 batch. I keep forgetting that. He looks so young, lagta hi nahi hai. So, okay, so more questions coming in?
Yeah, more questions are coming in. Ma'am, again, the questions are about it being airborne. I think people are asking that if it is airborne, how can we go in the balcony and get our vitamin D? If it is airborne, how can we stay indoors without a mask? Please.
There was a very interesting study done by Saikat Basu at the South Dakota State University. And he came up with the idea that 300 viral particles are needed for one effective inoculum. To give it perspective, about 1,500 viral particles are needed for influenza or common cold viruses. So this has a high rate of infectivity, potency. It requires about 15 minutes to 30 minutes of exposure, unprotected exposure to this virus in your immediate vicinity in order to inhale this inoculum. So if you know that you are in an open environment where you have not recently been, so if you are going into a conference room and you don't know who coughed there, yes, keep your mask on. If you're going onto a balcony where the air is open and you don't have any neighbor who's coughing into your face and onto your balcony, you can go ahead safely do that.
Right. And again, another question, we have two people asking this, that if it can be contracted through eyes, how can we protect the eyes? Is face shield now as important as face mask?
So Gautam, this is something that I think you will be able to help also. Some very simple measures like betadine are effective in killing the virus. If we were to do betadine gargles and just apply a dab of betadine in the nostril, you are safe for 2 hours. I'm not saying let your guard down. I'm saying additionally, if you do this, you will be safer.
If you think you have just come in to your house or to your place from a public place, you can do those gargles. You can have a disinfectant wipe on your face, things like that, ma'am.
Yeah.
Okay, a question from Prasanjit Majumdar. He's asking, does a COVID patient need to have a chest X-ray or a CT done after recovery? You've talked about an X-ray before, but you can maybe just answer this quickly.
So a CT scan or an X-ray are not needed for everyone. They are needed only if you're showing typical symptoms which are worsening, and that too for the chest. After recovery, there are some people who would want to get it done, but right now I would say it is better to stay indoors and trust your body. Be in tune with what your body is trying to tell you, and go back to the Indian roots.
If you are not showing any symptoms of breathlessness, then chances are that you really don't have a problem.
Yeah. Or ghabrahat.
Yeah. So now a question comes from Pankaj Sethi, 1986 batch. So I think we are all in a panic mode. So the question is, we've already contracted COVID in August and have got vaccinated with Covishield first dose. How prone are we to get infected again?
So as I said, if you had a natural infection, your vaccine becomes your second dose. No, irrespective.
It was in August. It was in August.
He got COVID in August. So
if he still has memory cells, his vaccine becomes his second dose. We don't yet know how many antibodies he has, whether they are neutralizing or not.
Yeah,
as of today,
but he will still go for the second dose.
Yes, as of today,
clarify that out.
As of today, there is no substitute to 2 doses of vaccine. Whichever one you're getting, you will get the same one as the second dose.
And again, if you were infected in August, you can get reinfected.
Oh, absolutely. That was a totally different strain. That was the first statement you made, Gautam.
Yes, absolutely. So just making it clear. And I think
we also had a comment coming from Shri Chirag Kumar Patel in California, where he said that he lost his friends despite 2 vaccines. Yes, I'm sure these things can happen. Our sincere condolences, sir, if you are still with us. कुदरत के खेल हैं, कुछ भी कहीं भी हो सकता है. At the same point, I think Dr. Saab has emphasized the importance of vaccine to all of us.
And
ma'am, one last question that is out there, which has been asked in our forum as well, and which is there on everybody's mind. When will this end? How will this end? When will we be free again? And as you can know, there is a lot of COVID fatigue that led to our second wave or so-called fourth wave in Delhi. Please, another round of messaging out there.
So what I can say is that the first wave, we were hugely successful because we were very strict, we were very vigilant, both administratively and in health infrastructure. Unfortunately, fatigue sets in, it's normal. There has been a lot of politics around the vaccine, unfortunate. If you look at what is the infection rate without the vaccine, right now we are looking at a positivity rate, test positivity rate of 35% in Delhi. In UK, they have found that after AstraZeneca, Covishield, with sharing one mutation, their infection rate after the first dose is 1 in 5,100 patients. After the second dose, it is 1 in 13,000 patients. And if you do not take the vaccine, it is close to 1 in 20.
Okay, so let me also just inform that Gautam and Aditya Ajit, two of these young boys, were actively involved in the COVID program of the Delhi government in the first and second wave. I think at present, both of them are not active. Uh, Aditya, if you are with me, Suman, if you can unmute, he can also share some experience about how he was tackling the first wave and if he has something to share with us.
Sure,
Can we
Aditya, please
unmute?
unmute yourself.
Yeah, Aditya is unmuted. Aditya, are you around?
Yeah, hi Manish. Sorry, totally off guard. This, I think it was a good experience. This time we are feeling more heat than the last time, is what I would say. मतलब पिछली बार बेड्स के स्टेटस और उस सब में मतलब बेहतर था सिचुएशन. इस बार ज्यादा पैनिक और ज्यादा स्ट्रेस है, ऐसा मुझे लग रहा है.
बहुत स्ट्रेस
I
है.
think, but I think, as Dr. Dhawan said, that I think fatigue. We have reached a point where we let our guards down a bit, and that has really shot this. That the spike is very huge because of that. मतलब सब कुछ खुल गया, सब कुछ मतलब सब कुछ खुलना गलत नहीं है. खुलने के बाद जो हमने उस जिस तरह से उस पर रिएक्ट किया, आई थिंक we let our guards down before we were completely in control of the situation.
So, and you know, when we thought that we are in the green, not just letting our guard down, but also COVID unsafe behaviors, parties, gyms, cinema halls. There is no excuse for this. COVID safe behaviors have to continue for at least another year. If we have to beat COVID, then we have to vaccinate close to 10 million people every day. We are doing about 3 million. It's a huge task.
And Manish sir, before the closing remarks, I would just like to point out to everyone that the purpose of holding this session, of sharing these experiences with you, is for you, not for you to get panicked, is not for you to become this extra, hassled and harassed about the situation. It is for you to get the right information and be rightly prepared. Do not panic. Everything can be handled, but only if we handle it the right way. And secondly, from the Delhi government perspective that I have received as part of my employment, I would like to share with you that currently our city is reeling under a lot of stress infrastructurally, socially. We are not having enough resources compared to the number of people who are requiring these resources. I would like to request all of you. I know we all are very sensitive people. Our school has taught us to give it back to the society before keeping it for ourselves and our family. But a lot of other people who are maybe in our social circle are not doing that. People are hoarding plasma, people are hoarding injections, people are hoarding oxygen cylinders when not necessarily needing them. I would like you to take back from this session this message of not panicking, not hoarding anything, be responsible citizens, and assist the actual needy people who are out there by this simple behavioral change of ours and please remain safe. Do not venture out. Do not do any non-accident, non-emergent work which involves going into public spaces. I hope you will take our precautions and the tips seriously, and you will also consult physicians in times of serious conditions. And thank you, and over to you, Manish sir and Suman.
Yeah, just a formal vote of thanks. Thank you so much, Dr. Dhawan. It was extremely useful, and yes, we'll all continue to take precautions and try and practice what we've just discussed. Thank you, Gautam. You were a nice, kind host with a lot of information under your belt with your experiences. Thank you, Suman, for taking all the efforts of organizing this session. It's good for people like me sometimes to sit back and leave everything to Suman and to Charu and to other people in the core group and just join the session. Thank you, Dharsa, and thank you all the seniors. Thank you, Bhavanites. We end the session here, and maybe we will try and hold another session in a week or 10 days or 15 days. We'll try and get another speaker to give more information. Thank you so much.
Thank you, Dr. Nidhi, once again. And
Thank you
Thank you
so
so
much.
much.
Thank you.
And
So, Suman, thank you so much for making this possible. And just a quick sum up, I would say that COVID safe behaviors cannot be left, that everybody is in a state of fatigue and is tired, but this is the time to become hyper vigilant, not to lose it. Day one is the day you got exposed to somebody who is developing symptoms. Alternate days are critical in your disease. Day 5 and day 10 become critical to decide whether you're going downhill or needing attention. Till then, you can actually stay at home and take better care of yourself. Don't burden the system, which is already reeling. Do not hoard, as Gautam said. Please share the resources. We can make this city much, much healthier, much, much sooner if we all become the point where the virus stops. हमारे आगे नहीं जाएगा.
Beautifully said. Beautifully said.
Yeah. Thank you.
Thank you so much.
Take care, everyone.
can I just add that the discussion is available on the Bharati Vidya Bhavan New Delhi Facebook group. We will let it remain there. This has now been a conversation of 1 hour. So do encourage your batchmates to come and revisit the session. There's a lot of important information that Dr. Nidhi and Gautam have discussed. And I think there's a lot of good information that we can take back from there. I might need to go in for a replay.
Absolutely. Same here.
A lot of us would be. A lot of us would actually.
Yes.
Yeah. Yeah.
Thank you.
Thank you. Thank you.
Good night.
Good night.
Good night.
Stay
Good night.
safe.
I'm officially ending this session. Thank you, everyone, so much. Thank you so much.
Yeah.